On behalf of the VVCA, I am pleased that you joined us today for our This is US webinar. Today is an exciting day for VVCA as we present to you three powerful women in the veterinary space. Dr. Carrie O'Hara of APG O'Hara Research and Analytics, formerly with Nationwide Pet. Deb Leon, CEO and founder of the telehealth platform whiskerDocs. And Nicole Rogers, Chief Operating Officer and Data Guru with whiskerDocs. We chose to keep this presentation a bit conversational because, to be honest with you, as we were going through a rehearsal, I felt like I wanted to record all the insights that were bubbling up organically as we dove into the data. So it may not feel as formal as your typical webinar, but you'll see why. The expertise here is unparalleled, and you'll want to hear their thoughts on data, why it's important, how to collect it with the highest integrity, and why the VVCA feels so strongly about evidence-based understanding of telehealth and the impact it can and is having in the United States. Today's data reflects over 90,000 interactions with whiskerDocs, the ones they had with pet parents in 2020. The VVCA appreciates the generosity of Deb Leon, founding board member and VVCA sponsor, and her whiskerDocs team for allowing us to share these valuable insights today. Now I will turn it over to Carrie O'Hara, who will host the remainder of the webinar.
Thank you, Allie. Well, we know that data is critical in the animal health space, and it is especially crucial when when supporting a brand new industry. Telehealth for pets. You want to establish a lexicon, a way of thinking about and describing your industry. You also want to establish common KPIs for three preliminary goals. One is to provide validation of your industry practices, or what are you doing? Two is to provide industry outcome research, or are the things that you're doing the right things that you should be doing? And three is to provide interpretive evidence as to what pet owners are expecting of your industry. So this is a great start. Thank you, whiskerDocs, for sharing this groundbreaking US-only data with us. And with that, I'll throw it over to Nicole.
Thank you for that, Carrie. So I am Nicole Rogers, COO of whiskerDocs, and my fun title is cat herder. We all have fun titles here, and it's really important for all of us that this is a fun conversation today. Our goal really is to be presenting insights into what pet owners need from us as an industry. We're going to be looking at some of the less commonly addressed access to care issues. For example, as we look at some usage trends, we're also going to be looking at why people engage. What are the topics that they need help with? And of course, how is all of this driving engagement with traditional practices, our traditional veterinary care models, and ultimately improving the health and well-being of pets. And with that, I'll kick it over to Deb.
All right, so let's go to the next slide, Nicole, just for a moment here. So, one of the things we will be presenting that is, I think, pretty important for us to all understand is how do people want to communicate with us? I mean, honestly, our conversation is often about access to care. And so what we're looking at is being responsive to the pet owner and how they want to reach out. And some days you can have an owner who wants to reach out through phone, some days through chat. And often that's driven not just by their preferences, but it could be driven by what's actually happening. So imagine being in a panic about a pet and what's happening and trying to chat when your hands are shaking. So we start to pay attention on a deeper level to all of those behaviors by the pet. 90,000 interactions is pretty substantial. We have over 200,000 in it. And part of what we're going to be talking here about is how do they want to interact? Why are they calling, to Nicole's point? And are they getting any smarter? Ultimately, when you build systems to support telehealth, you kind of want to know, is it working? So ultimately, the way to know it's working, and we talk about this also a lot, is are we elevating the understanding, the health intelligence of the pet owner and their impact on their ability and confidence on their ability to actually make a difference in the life of their pet? And I came out of human health, and so there was a whole lot of conversation as telehealth evolved around the consumer engagement and consumer ownership of their own health. And that can't happen unless they have access to information, unless they have transparency, unless they have what they need at their fingertips, and they have to have confidence. And that confidence comes from learning.
Right.
And so every single one of these interactions that Nicole's going to walk you through has this element of, is it a teachable moment? Are we elevating the health intelligence of the pet owner as we walk them through a situation? And I'm sure anybody who's a clinical person on this call will understand the idea of teachable moments. So we've seen over 200,000 teachable moments, and we've seen impact, and we're going to share that data. So you're going to see that as well. And then ultimately, at the end of this, I'd like to, hopefully, Allie, we have some time to talk about what data do we think now is really important to look at. Where are we going to drill down in this data? Because I'm actually as excited about next year's data as I am what we've learned this year. So that said, Nicole, it's all yours.
Well, Deb, I'd love for you to talk a little bit about, you had mentioned human healthcare. And one of the things I have found so inspiring about working with whiskerDocs and what we've done in terms of providing access to pet care on their terms is how we've structured it. And I think for everyone on the call, they'd really benefit from learning more about the human healthcare methodology that's been applied here.
Yeah, that'd be great. I'd love to. I think, telehealth, as we all know, has been happening for a much longer on the human side of the equation. And so a lot of learnings there do cross over here. There are certainly a lot of nuances that are and more than nuances that are different here. But some of the things that are the same is the same person is trying to make contact for a member of their family. It might be a different family member, but it is the same consumer. It's the same customer, the same client, and they have the same fears and concerns. And so this piece of data here speaks to some of the credentialing that happens on the human side and how important it is to have on-demand access, to be able to get to someone when they need it, which builds trust, it builds confidence, it builds all those things that we're talking about. But it actually, in a pet's life, and especially if toxin ingestions, becomes very important. So these are some of so you'll see measures here about how quickly we answer every channel, why that's important, and then things like when. So I'm going to let you speak to those numbers, but I wanted you to understand the methodology behind tracking that and why it's important.
Well, really fast, Deb, I was going to say, if you want to go back to that previous slide, one thing that really was, I thought, very interesting that I personally didn't know is how quickly the calls and chats are being answered. I couldn't believe this day. 90% of calls answered within 45 seconds, 93% of chats answered within 45 seconds. The reason why this is crucial, you hit on it a little bit, but when a pet owner is calling into your services, they're experiencing a crisis, a gap in their access to care. And so being responsive, as you said, is part of what we were saying is you have to establish your industry practices. And this kind of data tells you this is going to become the standard for this industry. And knowing these kinds of things is helpful for people who are outside of the industry to understand how you're treating it. So thank you so much for sharing this.
And you know what, I think that was such a great point, because this is actually what the consumer needs. Right. It's not something that we do because we think it's a good best practice. It is, but right, it's because that's what they need to happen in that moment, to your point. And so that ability to create systems around that, and it can be done, to create systems around that and understand the importance of being available on demand.
Right.
In the moment. Mm-hmm.
Real-time access to care.
Mm-hmm. Absolutely. Thank you for that, Deb. I think, and Carrie, I think one of the most interesting things that this is really the only comparative data we've got in here to a previous year, but really wanted to call out the trends that we are seeing in telehealth. And when we're talking about access to care, I mentioned before, this is one of the areas where we're looking at a less commonly addressed access issue. Look at the time of day. We're talking about peak periods of 9 a.m. to 9 p.m. Central, right? That's when consumers are reaching out for support and information. Most popular days of the week being Monday through Wednesday, right? And this is a pre-COVID and during COVID trend. Have been seeing it this way for years, and I think it was an adjustment for us. We never expected it to be that. We expected to see those spikes in the overnight hours when the traditional veterinarian was closed. But this has been the trend for whiskerDocs for years now. And really interesting when we're talking about access issues. People are at work. They're not sure if they need to take off from work. They're reaching out because they don't know if that episode of vomiting this morning or sneezing last night is reason to take off a half day or use up some of that personal time. Maybe they aren't able to get in for weeks, right? And just need a little help with that. But that's when they're thinking about it. When the owners are asleep, the pets are asleep, so nothing's happening in the overnight hours. It's happening all in the middle of the day.
Well,
and it's interesting. Oh, sorry, Carrie. What's interesting?
Oh, go ahead.
Oh, well, sorry. This is what we did, isn't it, Allie? This is exactly what we did the other day. But when you look at it, it's when people talk about gaps in care, they automatically think of geography, right? Rural access. Since COVID, now we're all thinking about availability of appointment time, of clinic time. But think about when we think about a gap, work. I have to work. I have a job, or it could be a Sunday afternoon, and I actually want my day off. I don't want to sit in an ER unless I need to. So, work now and life can become a gap. Mm-hmm. And so we have gaps in care in huge metropolitan areas.
Absolutely. And what we saw in 2019 and in 2020 definitely was that access to care was at an all-time low in 2020 for veterinarians specifically. And so you had a normal case in rural settings and in urban centers where it didn't matter when you would call. Sometimes you couldn't get an appointment for days on end. So what I see is that it's not a zero-sum gain here. What you're doing is you're providing an additional touch point for people to understand what is the next step that I need to do as a pet parent. And I think this is remarkable data to show that even during COVID years, access is a continuous problem and probably will be for the foreseeable future.
Yeah, very true.
Absolutely. So moving into who are the pets? Who are the pets that we're talking about in all of this data? I want to make a little side note that whiskerDocs is, most of our data has been gathered through partner panels, partner relationships. So some of the demographics that we see here might be skewed by populations of our partners. That said, the engagement overall is very heavily dogs. And I know we have Jane Brunt here today. So Jane, this is especially for you. Cats are very chronically underrepresented, even in the telehealth space. And I don't think it's any surprise. We know that they're chronically underrepresented in practice as well. One of the things I have found quite interesting is the number of senior cats that we do get contact about. The over 15 demographic is pretty high, and I suspect that the need in that category is even higher than what's represented here. So as we go through this data, I will be talking a little bit about differences and nuances we've seen across types of pets and age groups. It may not be represented on every single slide because the differences are marginal, but I'll speak to that a little bit. And of course, feel free to ask questions if there's information you'd like to know more in depth. This is an overview of the second level kind of category under health and wellness. What are the health concerns that people are contacting whiskerDocs about? The vast majority, signs and symptoms. I do want to note here that about 20,000, about 20% or 20,000 roughly, of our 90,000 interactions that we referenced earlier actually fall more in a resource management sort of bucket. People needing assistance in scheduling appointments for our partners, or understanding benefits and things like that. So as we dive into this data, we're talking more about 70,000 or so of those inbound touches. To give a little background about what is an interaction, I think that was a pre-question that we had gotten. An interaction would be an inbound outreach from a customer. whiskerDocs, however, it has multiple touches and manages these cases more like a complete case. We do a follow-up call and follow-up surveys. We send email summaries, and for every single one of those inbounds, there is on average 5 outbound touches associated with it, sometimes up to 7. So we're talking upwards of hundreds of thousands of communications with single owners around a single case every single year. No surprise that the vast majority of our interactions have been about signs and symptoms, and we're going to dive a little deeper into some of these top categories here in the data set. One thing I would like to note is that healthy pet care and behavior questions have gone up in the wake of COVID. And again, don't think there's a lot of surprise there either. People are more engaged, they're home with their pets, they're watching more, they're seeing more, and we want to keep that trend going. So as we dive into the signs and symptoms, what are the actual cases that come up? What are the symptoms that people have questions about? What are they watching at home? I don't think there's a lot of surprise here for the DVMs on this call. This is pretty consistent with what comes through practice doors. Gastrointestinal issues being number 1, derm number 2. I know in some markets that might be skewed opposite one another, but they're usually at least in the top 3. And ophthalmic, respiratory, urinary, and lethargy or energy behavior changes representing the next tier.
So when I look at this kind of data, it tells me that they're accessing you for the same reasons that they would want to access their veterinarians. And this is an important touch point to decide what they need to do next, but it's an immediate touch point that perhaps they haven't had access to due to safety concerns and COVID restrictions, right?
You know, what's interesting too about that is I think that, you know, a shift to thinking of this not so much as a replacement for, which we hear that every now and then, it's really about an opening into, right? This is the first touch, and it's an opening into, yep, you need to go see your vet. Yes, you need to go to this. It's an opening into whatever is the most relevant or appropriate interaction or intervention that needs to come next. And I think that's the way you look at it. It's interesting that it is an alignment, and what an opportunity as you build this continuum of care to say, here's an entry point into this whole system that will help fix these issues. And the other piece that we got excited about the other day was it's an opportunity for early intervention, right? The sooner that we catch this, the less costly, the less serious, the less chronic, the less everything. So when you look at the long-term effects, and this has been proven on the human side, we're so early now, we don't have that. But when I look at early intervention and then the correct level of intervention earlier, it's a win-win.
Absolutely. It provides a lot less strain on the actual medical services and puts more of an onus on preventative type things. And it relieves the whole system, because we all know that medical care in the United States is extremely expensive, right? We know this, and the costs are not going down, especially in the veterinary field. I know Nationwide and Purdue track this annually. The costs for veterinary care have been escalating year over year at astounding rates. I think the last time I looked at it was a 70% increase in some subspecialties in veterinary medicine in the past 5 years. So this really does provide the kind of stopgap touch point that a lot of pet owners need to ascertain what they need to do next. Where is the triage point? And I think that this provides an excellent first touch, as you said. Thank you.
Can I jump in real? Sorry, Deb, go ahead.
Yeah, I have a question about that. I've been hearing this, and I thought maybe with your data and all that you're seeing, we're seeing sort of a trend towards more chronic condition management as well, like a focus on it. What can we do with tech, with virtual care, to help with that, because that's getting to be bigger. Pet owners they're more engaged. They want their pets to live longer. Literally, they want them, their family members. So are you seeing any of that as well? Have you heard of that happening?
Absolutely. And, what we're starting to see is, especially with one particular group of pet owners, which happens to be the largest group of pet owners, millennials are really driving the desire for digital access to veterinary science. And what we see is that they want to take on the chronic care. They want to take on all these things that previously their veterinarian may have, in other generations, may have been the one who was the onus, who had the onus on it. But now what you see with millennials is a grand personal sense of agency, or being able to do something once they figure out how to do it. And telehealth provides one of the ways that they can access information, readily available information, accurate, good information, sustainable information that they can use to take care of their pets' chronic disease or otherwise. So absolutely, we're starting to see all of it.
So I'm just going to jump in and ask a data question, because what I see on this slide is actually fascinating to me, because I know just enough about clean data and data integrity. Nicole, can you explain, please, why there is not an other category? I'm putting you on the spot because I actually think it's a really important question.
Yep, absolutely. We feel very, very strongly that it is important that we narrow down as much as possible what this data represents. And our protocols on our side kind of force our agents down, our veterinary team down a path of making the most appropriate classification based on the presenting complaint. As you saw in the previous slide, we have a lot of other categories that can fit into more of those other buckets. But when we're talking about data integrity, we do not allow for an other under signs and symptoms. There are some others in some of our buckets, but not in signs and symptoms. Those are pretty clear in terms of what body system might be involved or things of that nature. And we believe really strongly that for us to figure out what the pet owners need from us, we need to make sure that this is as clean as it can possibly be.
Thank you for that.
Thank you. So moving into the next category of one of our top fives. On the previous slide, I'm sure you noticed I did not show the differences between dogs and cats. There was little statistical difference there, but in potential toxic ingestions, we see some interesting trends that I personally did not expect to see with what cats are eating. What are they getting into? I would like to clarify that when we're talking about household products in the toxins and poisons category at whiskerDocs, we're talking about household chemicals or things like glue. We're not talking about foreign bodies. Those are actually represented in our injury category. And we'll get into that in a future slide. But for the household products, generally, that's what we're talking about, cleaning supplies and things of that nature. I look at this and I'm intrigued about cats and food. It surprises me. I would not have expected that to be what we would see. Certainly for dogs, I don't think that the breakdown here is of much surprise to any of the clinicians. But for cats, I found it pretty interesting that the engagement was distributed the way that it is here.
They're putting things in their mouths too, just like dogs.
Mm-hmm. More often than I would have thought, though.
More often than we thought, right?
Yeah.
Nicole, isn't that one of those drill downs for next year? Like we just need to uncover that. And I bet you if Jane could have the microphone, she might have some insight on that and how to craft that. But I think that's really interesting.
Mm-hmm.
Mm-hmm. Yeah, I agree. So moving into injuries now, I mentioned foreign bodies on the last slide. Foreign bodies, again, no representation of dogs or cats on this one because statistically the same for the most part. Maybe off by a 0.5% or so, but the distribution of the caseload is about the same. Foreign body ingestions being number one across the board, musculoskeletal issues, paw or nail injuries, post-surgical issues, and encounters with insects. This is an example where you do see an other option for other skin-related injuries. One of the interesting things I think about as an industry, for us as an industry, is post-surgical complications and questions about post-surgical issues that can arise. This bucket would include things like minor hernias, potential infections, inflammatory responses to a surgery, and things of that nature. And I think as an industry, this tells us a lot about the kind of support that people need outside of the traditional veterinary care system. What additional education and resources do they need available to them to make sure that they're making the best decision for their pet when something doesn't seem quite right in the healing process? Now, in the healthy pet care category, I mentioned this is something that we've seen trending up. And for this, we decided to really look into not only dogs and cats, but also pediatrics. How is that different? And I think as we all sit here today and we're thinking about gaps in care, that's really the trend. A couple of the things that really jump out to me that I find out a little concerning, actually, is that people don't have more questions about parasite prevention for kittens or vaccinations, that those numbers aren't higher. That seems like a really big gap to me. Nutrition and weight management being high for cats, I think we all would expect that to be, especially for adults, excuse me, would expect that to be a pretty high percentage of the volume that might come in healthy pet care. But I think when we're looking at preventative care elements, the lack of engagement around that, the question is that because they're already so well educated, or is that because they're not thinking about it? Right. And I think as an industry as a whole, that's something we need to really explore when we're thinking about the future of virtual care.
Well, I have a quick defining question. How did you define kittens and puppies? Is that less than 1 year or is it less than 1.5?
Yes.
Okay.
Less than 1. Yep. Thank you for asking that and clarifying that for us, Carrie. Household safety, just for knowledge for everyone who is here listening to the webinar, household safety would be puppy proofing, kitten proofing, things of that nature, not focused on more of the behavioral side of things like crate training. That's a completely different data set. But that would be more about how to make sure your house is secure, set up gates, coexisting issues among pets, things of that nature. And earlier, Deb was talking about chronic diseases. And I think this is a huge opportunity for all of us as an industry. I think looking at this list, we're not all that surprised to see digestive, respiratory, dermatologic, and renal or urogenital issues being among the top. Those are the things that get diagnosed. And the thing to me that I think this really presents to us as an industry as a whole is the need for more support around these diagnoses once they've occurred. Filling in those gaps, filling in the education around what to try next when it's not improving, what to expect in terms of turnaround for improvement, right? And increasing access through telehealth and virtual care to get the answers to those questions is going to become critical. This is something we have been seeing trending up over time. And although it only represents about 3% of our interactions in 2020, it's something we expect will continue to move forward.
I want to jump in on this a little bit too, again, making reference to the human side of things, and that there was a big push to get into chronic condition management and managing a lot of that, which is sort of ongoing day-to-day. How do I deal with a chronic condition as a patient? And this would be, in this case, how do I walk a pet through and take care of a chronic condition in their daily life, which impacts almost everything. And so when we looked at that, what I was shocked about this slide is it's 3% of our interactions. When we would take large populations on the human side from a pet plan, we would have 3 to 4% of the people who had showed any kind of sort of symptom, whether it be an early symptom, just early symptomatic, an early event, all the way to really sick and hospitalized and maybe chronically hospitalized, multiple hospitalizations. But out of that whole data group, the level of the highest impact, highest cost were 3 to 4%, the prevalence rate. And so what happens is, that starts the brain thinking about what you said. How do I manage that on the expensive? That's a high cost area in healthcare on both sides. Yes. And then on the front side, how do we look at that earlier intervention? How do we use teletriage in particular to say we may have, you put this data together, we've got somebody who called and wow, it ended up being a musculoskeletal issue, or it ended up being some other, maybe it's the fatigue issue, right? And so you start saying, what's the rest we know about this pet, and where do we need to intervene right now? And we have a more engaged pet owner these days, and we're going to see more of that are actually, to your point, Carrie, they're going to want to know, they're going to say, I would like to participate in preventing this from getting worse as long as I can. And so, and because it's all out of the pet owner's pocket in most cases, because of our prevalence of pet insurance, hopefully that changes, but the impact is big. And I think you have a very motivated pet owner who is willing to intervene and spend money earlier in the process.
Exactly. But it's interesting because the themes that we hear from pet owners over and over again are cost savings. Number one, did you just hit on? Efficiency. How can I be more efficient? How can I use the resources that I have more efficiently? And it's absolutely time savings. And you have pet owners now that are more readily engaged, more actively engaged in just about every aspect of their pets' lives, more than any other generation. These younger generations are much more engaged with purchasing, with play, pampering, all sorts of grooming activities with their pets on a much grander scale than they were before, because they figured out that, I don't have to take my vet, or I don't have to take my pet to the groomer to be able to have my pet not smell on a Tuesday, so it's interesting. But you see these, and we're going to start hearing them more and more from the customer's point of view, from the pet owner's point of view. They want access to things that help them save time, save money, make themselves more efficient. So that's why that you're starting to see this. And I agree with you. I think that you're going to start to see more chronic conditions in the years to come. You're going to start seeing a lot more.
I'm going to interject if you don't mind. There's a question about this slide specifically. Robert Dawson from Vet AI, thanks for asking the question. He's wondering if you could explain a little bit or define and clarify the infectious disease category here. He says they don't see that as much in the UK.
Sure. So infectious conditions would be, this one is more on things like FELV and FIV in cats, and other potentially zoonotic conditions are the largest represented subcats in this area. So it is not, I'm very happy that is something that you don't see a lot of in the UK. But unfortunately, these infectious conditions in the domesticated animals in the US are more prevalent. And they tend to be things that have a lot of associated secondary complications, dental issues in response to some infectious disease there. So there's a lot of problems that will come secondary to those. And a lot of times the consumer just does not feel as empowered to know when it's an intervention point versus it's to be expected. So thank you for that question. So one of the other things that, I had mentioned really early on is the differences in terms of how we're gathering this data, and what the consumer profile looks like has a lot to do with our partners. And I wanted to kind of look at this on an industry by industry viewpoint. Pet insurance and veterinary hospital clinics being the entry point. I think those are pretty self-explanatory. As we talk through this, I want to clarify what I mean by other pet services. So that would be grooming, pet sitting, potentially microchipped pets or new adoptees through shelter channels. And then non-pet industry would represent employee benefits, human property and casualty groups, and alternative non-pet, traditional pet entry points. So all of this represents where did the consumer get access to the service? What channel did they enter in from? I think seeing about 60% for all of them are in the signs and symptoms category. That number is represented off to the side. Where we really wanted to look is what are the differences in these other areas, and seeing injuries be a bit higher on the utilization around injuries and toxins and poisons be a little bit higher for pet insurance. Probably not much of a surprise. I mean, we're talking about resource management here, right? And just because they have pet insurance and just because it's most likely covered doesn't mean they want to run out to the ER and have a $500 bill that they're going to have to get reimbursement for, right? So they're engaging because they know they have this resource and they have those kind of questions. Some of the remarkable differences for me are the needs around general behavior advice in the non-pet space. Yeah, that one to me is just, it's remarkable. And when we think about it, it makes a lot of sense. That's what they're noticing, right? They're noticing their pet's behavior, and they're needing some guidance around that. Perhaps they already have a relationship with a veterinarian, or perhaps they're not even headed down that path yet. They're too busy to be training and all of that, getting the puppy crate trained or housebroken, and things of that nature. So those are their questions. And Deb mentioned earlier, teachable moments, right? You call in because you're trying to train your dog to sleep in a crate at night because you're not getting any sleep. And it's a time for us to be able to step in and say, okay, well, now that you're going to try that, have you set up an appointment for his first round of vaccines? And provide a little bit of education around why that's important. And that's really the power of telehealth.
So Nicole, I actually have an additional insight into that because I talk to pet owners a lot. So, there is a lot of information that's available, breed-specific information that's available out there on the internet. The problem is that, pet owners are constantly trying to find the right information. They want validated information. Sure, there's a lot of information out there, but they want the right kind of information. And what this is telling you is that there are more unanswered questions out there than they think, than veterinarians actually think, or people that are in this industry actually think. pet owners have a lot of questions about their pets. And this is telling you that in, you're saying it was the voluntary benefits channel, a lot of people just say, hey, you know, I'd rather call this resource and get an answer about this thing that I'm seeing here than try to Dr. Google it, which I think is a huge win in terms of treatment outcomes for our animal health industry. Absolutely a win all the way around.
You know, I love that you said that, because I think sometimes who we really compete with in business is Dr. Google, right? And I think one of our very first clients was my next door neighbor, one of our first calls ever. And her dog was having spasms and she was Googling it and her hands were shaking. And she was just like trying to read through all this stuff and all the ads that come up and all that experience that was just it was not helping. As a matter of fact, she was getting more frantic. And then even she started to try to do a chat with us, right? And she couldn't even do that. And finally, she just picked up the phone and called me and said, could you just connect me to a vet right now? Yeah, 3 seconds, you're on. You know, I mean, but by the time that we got to her, after going to the internet, she was more freaked out than she needed to be. And that's another thing that happens in human health. And we kind of want to pull people away from that and engage them, to your point, Carrie, about validated content, and then steer them into the appropriate level of care. So service that teletriage in particular, I think serves a really good purpose in that step in the process.
Right, absolutely. And we know in the human health side that people stopped doing that because every answer they started typing in turned out to be cancer. So we're not quite there yet in the animal health field, but I think that there's still some trust in Google searches out there. And I think that, as you said, the more we can train people to get out of doing that kind of thing and talking with somebody who is an expert in this field is absolutely the better path to go.
Yeah.
One of my favorite, and just to add into the behavior a little bit, one of my favorite stories that we have seen is we had this gentleman call in a complete panic, believing that his 8-week-old puppy was having a seizure. And in walking him through, talking through the situation with him, it turned out the puppy was just dreaming, sound asleep on its back, on his lap, right? And I think it tells us a lot about the dangers of Google, because that's how it got there, right? He's trying to type in twitching in puppy and lands on, oh my gosh, he's having a seizure.
Seizure disorder, I was going to say.
Catastrophic. Yeah. So that's where he landed, and he was in a panic, and thank goodness he called.
Yes.
Because it wasn't, and it led to all of those teachable moments too. He got the trusted, validated information.
The dog was just chasing something in its dreams and having a fine time doing it.
Off chasing a squirrel. Yeah, absolutely. So Deb, you're really good at just teeing up where we're going next. The appropriate care at the appropriate time. This slide, there's a lot of data to digest here. Little bit of background on how we get there. At whiskerDocs, we get comparative analysis on 3 key data points. We ask the consumer on every single interaction, what level of care would you have sought? What would have been your next step had you not had the assistance of telehealth? Then, of course, we have the level of care that we feel is required for that pet, the guidance that we are providing them to help them make that decision on where to go next. And then the third data point, which will be represented in the next slide, but I'm going to tee it up here, is the same data point, except what is the action they ultimately took. So in this slide, when we're talking about driving appropriate care at the appropriate time, your wheel off to the right is representing the overall level of care recommendations. About 53% of all interactions with whiskerDocs staff have landed in a home-based level of care, and 40% referred to primary. Only 10% or so have been referred, or 7%, sorry about that, have been referred to ER. One of the things we like to really look at is where are the missed opportunities, right? And where are we potentially losing people to things that they shouldn't be doing. One of the most remarkable stats, only in 2020, only 70% or so of ER cases, only 34% or so of ER cases needed ER. So these are individuals who said, I would have gone to the ER. 70% of them didn't need to go, almost 70%.
Amazing.
Pretty remarkable.
Yep.
But for all the primary physicians on this call, look at the fact that 21% of those needed to be coming to you.
Yeah.
And it could be a day from now, 2 days from now, 3 days from now, but that was where they needed to be, was in your office. And in the absence of having those access issues that we're talking about here today, or having another channel, where they would have ended up was in an ER. So that's one opportunity. And then when we look at these more passive actions, the people who said they would have monitored at home, that they thought it was just behavioral, that they would have just Googled it. We've got 28% of those needing to go in for an appointment in the monitor at home category. 7% of these behavior, quote, behavior cases, not being behavior. They need workup before you make that assumption. And 15% of the people saying they were going to just research it online and do something more passive, and who knows what information they would have gotten, really needed to come in for an appointment.
You know, Nicole, one thing that really, I think that the wow moment for me on here was, I think about veterinarians' days way more often than I probably should. But when you think about what a veterinarian does on a day-to-day basis, and how their day is, so, you know, I just had this huge research project where I asked veterinarians, you know, what was it like during COVID? What is it like during COVID? And the number one thing is that they said they're stressed out, they're overworked, they can't see their patients, you know, and there's so many new ones to take care of, you know, they're talking about burnout right now. And then I look at this circle chart here that says, you know, it's a 50-50 split. When they call you, you're telling them 50% of the time to do it themselves. You know, you can relieve the strain of having to go see a veterinarian by doing it yourself, by educating yourself, and this is what you do. Versus, you know, all those people having to tax the system that is already taxed. So I see this as a prong the veterinarians, or a service offering the veterinarians should absolutely be using when just thinking about their days and how crazy they are. I mean, how many people or how many pets have you seen that you really didn't need to see, but the parents were so anxious they had to come see you? And because that person took the slot, was there another animal that really needed to see you that wasn't able to now? So I see this as a releasing of the pressure that is at the veterinary practices right now in the United States, that everyone's been complaining about. And I see this 55% or 50% of the time, you know, doing it yourself and doing it at home, having personal agency is a great thing that you should be really clamoring about here.
You know, that absolutely. We think of it too as alignment, right? Alignment of the appropriate intervention level to what's actually happening. And that creates all sorts of great financial outcomes. It really does, because people that are trusting a system that is doing that will spend more with it. And there's just so much that can happen from here when you start aligning those two, to your point, Carrie.
Yeah. Absolutely. And to your point, Carrie, on those would have made an appointment, 34% of them really didn't need to go right then, right? They didn't need to. 45% of the people going to ER. And I think all the clinicians on this call certainly understand that feeling of, you know, putting styptic powder on a nail while you've got a patient coding or in critical condition in a cage in the back, right? It feels horrible. Right. It feels horrible for us as professionals that's what's going on. And especially in COVID, we've seen huge wait times you know, hours and hours and hours at ER facilities. And we're sitting here looking at this data and thinking, oh my gosh, how many of those things, how many pets could we have saved? How many conditions could we have stopped from making worse just by intervening and providing a little bit of support ahead of time?
Right.
So Nicole, as we change slides, I do want to make an announcement that we are 51 minutes past the hour. I feel like we could probably spend an hour on each slide, but before we continue, and ladies, we did not talk about this beforehand, but I'm more than happy to just keep going. We can record the whole thing and people can stay if they can stay, or they can drop off if they need to drop off. But I do have two questions that I don't want to hold until the end, just in case those two people can't stay for the whole thing. So I wanted to just flag, there is a question about second opinions. Do you have a feeling about whether or not whiskerDocs specifically, or telehealth in general, is used for second opinions by the pet parent?
Interesting question.
Sure. So it happens on occasion. I would not say that that is the most common use case under any circumstance. These second opinion cases are more likely to come in from frustrated, and this is anecdotal. I don't have this as hard research, but my experience through our quality process and in listening to calls and reading through interactions, they're more likely to come in those chronic cases where several appointments have been made, no progress is being made, and there's confusion about treatment plans. That said, most of the interactions, though, are more around directing to the right level of care and less about who you're going to see to do it.
In my research on telehealth, that's what I had unpacked as well, is that I hadn't heard any real use of it in any meaningful way for second opinions. It really is just to check in about the pet's health.
Don't you think that will come as telemedicine evolves? I think you'll see more of it then, because it's a deeper dive into records and, you know, the kinds of things you need to do to make a good second opinion.
Right.
Great. Yeah. Thanks. Good answer. The other question is back from a couple of your slides previously, we were talking about chronic conditions, and one of the practitioners that I know would like a definition of the word chronic. How do you define chronic conditions?
Sure. So these are conditions, we define them as conditions that the consumer has reported as being previously diagnosed by a physician. So there's actually a name for it, like CHF or something along those lines. So these are animals that are most commonly on medications, and the owner has disclosed that to us, and or have been given a diagnosis, and they're able to tell us exactly what that diagnosis is. Otherwise, that interaction does not go into the diseases category because we're not in the practice of diagnosing. So the only way it ends up there is if it's disclosed to us with a specific name.
Okay, I think that was my only two questions so far. And please feel free to ask questions as we're getting through these slides.
Absolutely. Okay, so as I mentioned on the previous slide, we were talking about that third data point. What's the action that they actually took? And from where we sit, right, what we need to be doing is impacting the consumer's behavior. We need to be delivering our messaging in a clear and concise way that can meet them where they are and help them be successful in seeking the level of care that's needed for their pet. Almost 73% of the customers that we spoke to in 2020 ultimately took the action that had been suggested through our decision support process, which is a really powerful number. And that's what we want to see happening. This is all about how we increase that compliance with the whole care system across the board. How do we make sure that people are taking the appropriate actions at the appropriate times? And so much of that is the delivery of the messaging, making sure that we're not shaming pet parents who can't afford or can't get there today, but maybe they can next week, right? And making sure that they understand what the pet's needs are and what they need to watch out for in the interim.
Well, and this is one of those data points that it's table stakes. You have to show as a new industry that you are creating impact, you're creating change, that you're there doing the things that you're supposed to do. And I think this pie chart tells that perfectly.
You know what else is true about that? I'm so glad you said that, because the other thing is and I don't think we have it here, but we've been tracking this over time, year over year. Is our ability to impact behavior improving? And it is. And it's sort of, it's a number of factors. Repeat users are getting smarter. And so their initial perception of what might be the problem is correct. So they're much more easily, falling in alignment with what we're going to recommend at that point. But the other thing is, I think, as to Nicole's point, you start to, as you do this in volume, you start to get smarter about how to approach and how to create impact. Things like mirroring, right? Simple things that how to influence behavior that has to be done virtually instead of in person, face to face. And so those skill sets really get honed. And we also find, and this is for everyone that is either in the industry or thinking about getting in it, I know someone has got a question about that. It's another skill set when you can do these things and impact patients and impact caregivers virtually versus, even with a chat. You have a lot less tools to work with. So we have to get really good at that, and we have to do it efficiently.
Absolutely. But what this is really, all of us on this call, I think, are in this industry because we want in some way to provide or be a part of having better quality outcomes for our pets. And what this says is that this is providing one of those touch points for a better quality outcome for pets across the United States. And so I find this extremely valuable. Thank you for sharing this.
I do have one other question about this slide specifically. I think we've talked about it before, but can you just remind everyone, how do you measure these impacts?
Good question.
Thank you for that, Allie. So it's a comparative analysis. We take into account what the initial intention that they reported. Were they going to go to ER or just Google it? And we measure that against the recommended level of care that we've provided, as well as the ultimate action that they took. This data is collected upon follow-up, and we have 2 points of outreach for our follow-ups. We do outbound calls and outbound emails automatically. We also started doing an outbound interaction survey in 2020 that's provided some additional really exciting insights that I have on the next slide.
Excellent, thanks.
Did that answer the question?
Yeah.
Okay.
All right. I skipped over because I'm trying to be cognizant of time, but maybe I should just go back there for just 1 second. I think this is surprising for everyone, not surprising for everyone. 98% of people, and Carrie, I know your research speaks to this, they want this, they need this, and they feel it's valuable. 98% of our customers are satisfied, and so grateful that we are there. And as I mentioned, those surveys. So in 2020, we decided we needed a much more organized way of figuring out, are we making a difference in the health of the pets? How is their condition after? And because we're telehealth, we're not diagnosing or prescribing. This is the closest we have at the moment to true health outcomes. And this is user-reported data, so this came from follow-up surveys. But almost 54% of the customers said that their issue completely resolved following their interaction with our team. And I think that speaks volumes to the potential of what we can accomplish in a safe, effective, cost-effective way, time-effective way, all of those things for the pet-owning population in this country. This is just the beginning of gathering this data, and I think we're going to see a lot more in the years to come.
Well, this slide explains the former slide. So if 85% say that, you know, it's better, then that's the reason why they're likely to recommend you and come back.
Yeah, absolutely. Absolutely. So that we actually did make it to the end and pretty much on time. So a couple minutes over, but I think we did really well.
Good, nice job. I do have 2 more questions that have bubbled up, and I think since we've got a little bit of time still, someone's asking about toxins. You know, saying there are so many. What does whiskerDocs vets do if they don't have information about the particular drug, plant, etc., that a pet may have ingested?
Sure. We have a really robust database, so those instances are pretty rare. Our standard protocol would be to talk through the classification of that item as number one. Even if, an example I like to use is antidepressants. There's new ones on the market all the time, right? But we know what drug class they fall into and therefore the likelihood. The default response would be to kind of up it one level of care if you don't have indication. Certainly can get over to a toxicologist if necessary and do those transfers or refer into ER. But usually working off of classification of a medication in particular, you're able to get pretty close to what the level of care would be. Remember, we are more focused on what next step to take. So our focus is on the intervention level that's required, not so much on determining the course of treatment. So for us, it's more about, does this need intervention or not?
Great answer. Thank you. And I think the last question we have, which I actually really love, this is a great question. It's for all of us to answer. I think all 4 of us. A new VVCA member, I know because I saw her join this morning. So welcome, Ellen, has a question about how to get more involved in the field as a non-clinical veterinarian. She is already practicing teletriage, but she would like to, I think she said earlier that she'd like to get more involved as a leader and kind of find her niche in this new part of the industry.
Who wants to go first?
Did she
I
join
think Deb wants to go. I saw her start talking.
Yeah, I did. Did she join
did.
VVCA?
She's a new member from this morning, and so I'm delighted. I think that's a good first step, obviously, because we are always looking for the new leaders in this space, the early adopters, the ones that are the most curious, the ones that are most innovative and willing to kind of take this journey with us. I think that was a great first step. So that's probably would have been my recommendation.
You know, the other thing I want to add is as we start to look at all this data, I think it becomes obvious how much more work there's going to be in the future. And even in VVCA, we keep seeing more and more things that we need to educate or provide resources on. And so I think the work that we all have in front of us grows. And so we just say, welcome, hurry up and help and find what your key strengths are and find the place where we can put you into this wonderful movement forward.
Well, and it's a timely question as well, because I just completed a huge study looking at pet owners across the across the United States, and the demand for telehealth is only going to increase. The largest group of pet owners think of it as a third prong to the access to care. So it's a great time to come in, and you happen to be involved with some ladies here who have some insight on how exactly you can do it. So more than welcome.
You know what, there was a question on phone systems and that. So how would we help with that? Because that actually matters, sort of the tech you're using to service. You know, and it varies on the kind of and the scale of service you're providing, but we certainly would talk to anyone about that at any time.
Terrific. Maybe I'll make that match for you guys. One last question. because we still have time, and there's still Jenica, I will make sure you're connected. Don't worry, I'm on it. Carrie Marshall, thank you for joining. She says, what data and tools do you provide your veterinarians?
So I'll take a start at that one. We have a really robust resource library. We maintain, of course, veterinary pharmaceutical manuals, toxins databases. We also have resources for like referrals and academia for more complex issues. That's really important to us to make sure that our customers are always getting the most up-to-date research. Our team also goes through monthly meetings, the team as a whole, to reevaluate those resources, look at our individual cases, and talk more about how we can improve the overall service. And that's actually required for the entire veterinary team here at whiskerDocs. They're expected to attend 75% of those in a calendar year, which can be a little tough when they're all remote. And they're as far as Hawaii and Florida and Maine. So, we've got all of the different time zones covered. Our resource library at this point has probably over 24 different modules in it to help support our team in being successful.
So if you want data, tools, or access, you know where to go.
Yeah, definitely reach out to me, Allie at vvca.org. I can make connections and I can get you resources. Please don't hesitate. That's what we're here for. We are the only industry association that's tackling this big new beast, and we're really happy to be partnering with all of you on this journey. So thank you so much for joining.
Hey, Allie, with that, I actually want to throw out one last thing because I think it needs to be said. Thank you, whiskerDocs, for doing this. I come from my former profession was in a niche community as well in pet health insurance, and one of the things that we put as an onus on our brands was to provide industry level data for people who wanted to know more about our industry. And it had to come from us and be called by us and published by us, which was a difficult thing to do. But what was, especially when you're talking about a whole bunch of different organizations sharing their data and then publishing it for everyone to know. So I grandly thank whiskerDocs for doing this. It's a tremendous act of courage to put your data out there for people to enjoy. But it is a necessary step in an industry that is starting out. So I call on others that are also in this industry to contribute to the intelligence of the industry, to give it legitimacy. It's one of the best ways of doing it. I don't think anybody, as a matter of fact, I can tell you for a fact that nobody thinks pet health insurance is a joke anymore because of all of this industry level data. And that was one of the ways that we did, we turned it around. So please, if you run a telehealth group in the United States, please consider joining the VVCA. If you're not if you're already a member, please think about working with Allie to provide us with more data so that we can understand more about the industry as a whole.
Terrific.
That was my PSA.
That's a great way to close. The VVCA is, actively engaged in looking at aggregation of data, collection of data. It's not going to be just individual platforms providing data with us forever. We just felt strongly that what we had, we should present. Absolutely. And with the help of Deb and with Robert Dawson from Vet AI, we've covered the U.S. In a very, I think, statistically significant way, and we covered UK. And even though they have some nuances that we don't have, I just think pulling data together is going to be our next step. You're absolutely right, Carrie. So thanks for mentioning that.
It's a great way to tell people who don't know your industry, to give them insight into how valuable you really are. Honestly. Great job, guys. Thank you so much.
Thank you, whiskerDocs. Thank you, Deb. And Nicole, thank you, Carrie, for hosting. I appreciate all your insights. You guys have a nice day.
Everyone have a wonderful afternoon. Bye.
Bye.
Bye-bye.